Were the lockdowns a failed pandemic experiment? You know what I think about that. And a new book titled The Big Fail, What the Pandemic Revealed About Who America Protects and Who It Leaves Behind, agrees with me and makes the case that the United States' decision to embrace lockdowns is the policy failure that has loomed largest over the country since 2020, and that for any purpose other than keeping hospitals from being overrun, they should not be repeated.
Meanwhile, New York University Stern School of Business professor Scott Galloway asked for forgiveness on his original view of lockdowns at the start of the pandemic.
Well, I was on the board of my kids' school during COVID. I wanted a harsher lockdown policy, and in retrospect, I was wrong. The damage to kids of keeping them out of school longer was greater than the risks. But here's the bottom line. Myself, our great people, the CDC, I'd like to thank the governor, we were all operating with imperfect information, and we were doing our best. So
well. So let's learn from it. Let's learn from it. Let's hold each other accountable. But let's bring a little bit of grace and forgiveness in the show that was COVID.
Yeah, I think that's interesting. I was just saying, I think that's interesting because, well, sure, policymakers are always doing what they think is in the best interests of people, right? They're justifying it that way. They're saying, oh, this is for the greater good. One of the reasons I'm a libertarian, or I think a limited government outlook is best, is that it prevents people from doing horrific, destructive things, even if they think it ought to be good for you or healthy or beneficial. As we say, well, you might think that, you might want to do that, but you can't, because we've constrained, there are limits on what government is allowed to do. We have to allow individual liberty. We have to let people organize their lives how they see fit and make decisions for themselves on what they think would be best for them. There's no central planner, central authority figure who can decide for you better than you can what the right thing is to do, and we should generally not give those people free rein to implement policies that they think ought to be great, because they, especially when they have as disastrous a track record as our government does. So that was a very interesting clip. So the book, The Big Fail, that's out, I read an excerpt of it, I believe, in The Atlantic, and it's very interesting, and it looks at a lot of data comparing countries at various stages, looking at studies showing what the overall death rate, not specifically just the deaths from COVID, because you could say, well, maybe you've lessened, even if you've lessened deaths from COVID with lockdowns, let's say you have, although I think they don't find a lot of evidence for that either. But what if you worsen deaths from addiction or alcoholism or poverty or something else, given that is made worse by having the lockdown? So let's look at all-cause death, and what they found is that for Sweden, for instance, which didn't lock down to nearly the degree its neighbors did, actually had a lower all deaths from all causes. So there's a lot of, and then if you look at the states in the United States, there's different lockdown policies in different states at different times. What you find is that it just didn't add up to vastly different COVID outcomes in terms of deaths. Maybe it kept infections down at some point, but deaths were all over the place, and we're reflecting the underlying poverty and health problems in the communities being affected. We didn't, and no nation substantially stopped COVID deaths or made death less likely overall by locking its population inside their homes.
Yeah, it's fascinating because we can't really treat this data that we have like we ran some kind of experiment. You can't do a randomized controlled trial. You could try. It would be near impossible. And that really gets at the heart of making public health policy, is that policy is only as good as it is implementable, as it can be implemented in the population. Even in cases where you had a lockdown, people had to have food delivered. People had to have some contact with other human beings. And is it safer if one person is delivering food and groceries and supplies to an entire building and has contact with every single person in every single door? Does that make sense? Can we truly have a situation where every individual or every family is isolated, or rather every household is isolated? It's near impossible. And I think that's really what we have to grapple with when we're making policy. We can't really A/B compare a control group population where people were allowed to be out in public and another one where people were locked down, because no two cities' populations are comparable directly. Every city has a different structure. We also can't divide a city in that way because of what I just said. You have this supply chain issue of people need supplies. They need food and water to live. They need to have some contact with other people in order to get those things. There were some cases where they tried to do it safely, but I think in the whole, the policy needs to be evaluated in the context of the virus we were dealing with as well. I read a lot of research about how smallpox was eradicated, and this was a very different virus from this SARS-2, COVID-19. Any SARS virus, once it's in the population, mutates. Smallpox was a very different situation, easier to eradicate, because once it's in the population, it's not permanently in the population in the way that SARS viruses are. And so I think the appropriate thing to do is do what Scott Galloway did. Say, we made policy with the best intentions with the information we had. And I think going forward, we can figure out ways to do pandemic policy making in a way that keeps everybody safe without destroying people's lives, quite frankly, for, outcomes that don't outweigh the potential benefits. And I think that's the calculation a lot of people are making with lockdowns. And also, can it be implemented in a population of people that relies on each other on a daily basis to have their basic needs met?
In this Atlantic article that is in this book, The Big Fail, they also talk about how lockdowns were never part of the handbook, really, for how to handle a pandemic. Shutting down all of society, keeping people in their homes, closing all businesses, closing everything was not actually part of the toolkit. And when China started to do it at the beginning of the pandemic, there were a lot of actual health professionals' reaction was, that's wrong, because that's not what you're supposed to do. And then the consensus very quickly changed that we needed. First it was sold under the whole flatten the curve kind of logic, where we need to have a lockdown period so that hospitals can gear up, so they're not flooded immediately, so we don't have to do ration care in that way. And then there was a subtle evolution from that, because most people, frankly, were on board with that. But then there was an evolution to, no, we're going to keep the lockdown going until we can substantially reduce the danger of COVID or even eradicate COVID. And some municipalities, even some island nations, tried to implement that for a long time. And China kept with that, and then finally, years later, finally gave it up. And what do they had? Then they had a flood of COVID cases, and they had 1 million COVID deaths because they had maybe delayed the inevitable, but it wasn't any less inevitable because this is not an effective. This is an immiserating policy. It's not an effective policy. It never was designed to be an effective policy, and it's shocking and frightening how quickly and eagerly health authorities and officials in our country embraced it. To some degree, we had stricter pandemic measures than a lot of even our Western peer countries. Some of them didn't lock down schools to nearly the extent we did, didn't require masks of young people the way we did. Many of them didn't have actually as strict vaccine mandate requirements as we did. So it's really interesting. And we still had, somewhat worse results in some places in our country. That's reflecting the overall health problems. We have more obese people. We have more people with underlying conditions. We have a less healthier population, and we suffered because of it. It wasn't because we didn't try lockdowns hard enough. That could not be more clear.
Yeah, I think when we compare the United States to other European countries, I think about the trust a lot of Americans have in the decision makers in U.S. government for public health. I think about the FDA and how many people in the United States are critical of what foods are approved in the U.S., what kind of chemicals we can eat that are banned in European countries. I think about the FDA's relationship with pharmaceutical companies. I think about the FDA's relationship with corporate agriculture, the kind of revolving door we have between being on the board or an executive at one of the large agricultural conglomerates and then going and serving on the FDA. It's disgusting. It's absurd. It's obviously a conflict of interest. People already don't have a lot of trust in the United States government when it comes to public health. They also did a terrible job messaging around COVID-19. the changes in policy at the federal level that then had to be translated to the state level really caused a lot of confusion and a lot of chaos. You can't tell people one day everyone needs to be masked up, everyone needs to be home, change the social distancing requirements, change the masking requirements, change whether or not schools should be open or not. It was just impossible to interpret what they were deciding on, why they were deciding it, why they were changing their minds. They just really did a bad job communicating to the public. And I think that made the mistrust people have in the U.S. that much worse, and it made their policies that much less effective.
Yeah, very much so. We'll have more Rising right after this. Please stay with us.